A patient comes into the clinic mainly complaining of droopy eyelids or difficulty with their peripheral vision. As soon as I walk in the door, I'm taking a look at that patient's eyelids to see how much excess skin is on their upper eyelids, where their position of their eyelid falls in relation to the visual axis or where their pupil is. There's two types of droopy eyelids that I see. The first type is when there's just a lot of excess skin between the brow and the eyelid, and that accumulates over time and with age. The second type is where the whole eyelid is drooping down, and that's secondary to loss of muscle tone in the tendon and muscle that controls eyelid height and movement. So although very similar, they're also very different, and the surgical approach that we address is a little bit different, and oftentimes patients will have a little bit of both. I tell these patients that there is no medical treatment for the problem, but there is a surgical treatment, and that surgical treatment is an outpatient surgery. This surgery is done in about 45 minutes for most patients, and we're able to do both upper eyelids. The surgery involves removing skin from the upper eyelids, and if necessary, going a little bit deeper into the eyelid and manipulating the muscle that controls height and movement of the eyelid. The most common question that patients have is my insurance going to cover this? And in most insurances, yes, it will be. To answer that question of will the insurance cover it, we do a couple of things in the clinic. We will do photographs of the eyelids demonstrating the position of the eyelid relative to their eye. The second thing we do is a visual field test. The visual field test assess whether the eyelid position is interfering with their vision. If the eyelid position is deemed to be interfering with their vision, then oftentimes we can get the insurance company to cover that. In certain instances where insurance companies will not cover their droopy eyelids, we're still able to do that, and that can be done in the office or it can be done in a surgical center as well. Some patients also have complaints about their lower lids and to their face in general. Generally, they're not happy with their appearance, and this happens with age and with gravity. The lower lids are a specific concern for many patients. They're concerned about the fullness of their lower lids, or to a lesser degree about the wrinkles on their lower lids. These can be addressed, however, they're not going to be covered by the patient's insurance. The number one way that we address the fullness to the lower lid is a similar procedure to the upper eyelid, where we go behind the eyelid and we're able to sculpt away some of the fat and manipulate the fat that's behind the eyelid, and this helps rejuvenate the eyelid and give it a more youthful appearance. In some other cases, we're dealing with, instead of too much volume, too much fullness, we're dealing with a lack of volume or a lack of fullness, in which case we can use products called facial fillers that help provide some fullness. The most common location that we use these are on the sides of the nose, sometimes down here below the chin, and also in the lips, and these just provide volume. These types of things can be done in the office, and they have very good results and very short turnarounds as far as recovery and follow-up.